Welcome to The Younger You. Today, it's all about being youthful and looking your best. But what do we do when injectables and non-surgical procedures no longer work? Well, guess what? Today, we will show you the next step in regaining that younger version. Board certified plastic surgeon Dr. Nimtz is our wonderful surgeon who is joining us today. He's one of the best when it comes to performing what we call a traditional facelift, and he's going to answer all of your questions. Welcome to the show, my friend.
Thank you.
Explain to everyone at home what a traditional facelift is, because there are so many different brands of facelifts, but they're normally penned by a surgeon, like an Encore facelift, or it's still similar, isn't it?
Yeah, these are basically just variations on a theme. A traditional facelift involves an incision that goes in front of the ear and then traces behind the ear back by the hairline and is used to pull up the skin and raise up the cheeks.
Okay, so let's talk about, that's a traditional facelift. Let's go into what everyone seems to know as a mini facelift.
A mini facelift is basically just raising up the cheek area, okay? So it depends on how much you want to raise up, which areas you want to raise up. A mini facelift will raise up just the cheek. It's not going to do anything for the neck, the jowls, and so forth.
Okay, so now you've brought into the neck and the jowls. Is that what you class as a full facelift?
Correct, yeah.
Okay, so when we do a full facelift, I know people have injectables, they have resurfacing. Talk us through some of those processes and what's available.
Right. The traditional facelift that started off, let's say, in the golden age of Hollywood was basically just taking out a little bit of excess skin here and there. And as time has proceeded, we've started doing other things like raising up portions of the face, such as the cheek. We've started adding things, such as fat grafting. We've started resurfacing the skin with lasers or chemical peels and so forth.
Okay, so let's go back to the full facelift, because that's what we did today. What's the sort of recovery time? How do you prep for a facelift? Let's talk about that.
Basic things for surgery are don't use aspirin, don't use any ibuprofen, make sure there are no herbal supplements. Those are the basic things just to prepare. Other things after surgery would include things like decreasing your salt intake, keeping your head of bed elevated, not doing too much. I do want people active. I do want them going about their normal routines, but other than that, not too much.
Okay, so on Sharon today, where did you do the scarring? Like, where did you do the stitches, I should say?
Yeah, her scar came basically around by the hairline, traced back right in front of the ear, came down here, came around the ear and back by the hairline.
Wow, okay, so you did a full facelift.
Correct.
So that's lifting the neck as well.
Correct.
Now, we talk about lower and upper bleph also when it comes to facelifts. Is this something that you did on Sharon as well?
Yeah, we did a little bit of a brow lift as well as upper eyelids on her.
Okay, so there's another conversation that people say is, I've had a facelift 6 months ago and I'm still, you know, I'm still swollen, is what the wording is.
Well, most of the swelling is going to decrease within the first 3 or 4 weeks or so. However, there will be some residual swelling, and it will take months to resolve.
Okay. Now, let's talk about revision. What happens if they say, hey, I would have liked a little bit more off my chin or a little bit more off my neck, or can you go back in and do a revision surgery?
Yeah, that's a common thing that we do, especially with facelifts. As there may be some asymmetries here and there, we can always take out a little bit more skin, and usually those are done in an office setting.
All right, let's talk a little bit about back in the day. People still fear that thought of having a pulled, stretched look.
Right.
How has that changed? Why was it happening then and not so much now?
Historically, they looked at facelift as just a tightening procedure. They would just take out that excess skin. And as we realize more how people age, we realize that there is a drop in the tissues. There is also a loss of volume in the face. So in order to restore that and give a healthy, youthful appearance, you're going to have to restore that volume as well.
I got you. Another important question that we get asked a lot on this show is, after you have a facelift, how long before you can go back in maybe and have a little bit more of a tightening, or a bit of a tune-up, as they say?
Well, you can do small revisions here and there along the way as needed for a person. However, Some people ask, well, how long is the facelift going to last overall? And that's a more difficult question. Usually somewhere around the 7 to 10 year mark is what I tell people. However, when you do a facelift, you're basically resetting the youthful clock, if you will.
Okay.
And so you're always going to look better than you would have had you not had that facelift done.
All right, well, great answers. We appreciate you coming in. Coming up, we'll learn more from Dr. Nimtz about this procedure before we meet our patient, Sharon. For more information on The Younger You or to rewatch this episode and others, head over to theyoungeryou.tv. Alrighty everyone, now it's time to meet Sharon to find out why she wanted a facelift.
I am having my eyes done, brightened up, and I'm having the extra skin in my face tightened up, and also my neck. For me, timing is everything. Nobody in my family is fully dependent on me any longer, and that was important because I know that this procedure will take some time. This is something that I didn't think about before this opportunity came, but I did notice that the aging process was in full swing. I see a woman who's in her 50s, who is happy and active and has a full life, but just has skin that has aged differently than my life. I'm hoping that the changes that have already been made aren't so drastic that there is a lot that will have to happen in order for me to just look, normal and fresh.
Plastic surgery is an interesting combination of doing something very physical, but it has dramatic implications for somebody's inner sense of self. When you're considering restoring someone's face to give it a more youthful appearance, everyone is going to need something different. Some people may need more of a focus on their eyes. Some people may need more of a focus on their chin or their neck or whatever that situation may call for. Two major processes that are occurring in the face that you're trying to overcome. One of those is a gain in skin that people get as we get older. The second one is a sag or a droop in some of the fullness in the face, or even a loss of fullness in the face. If you do a facelift, you're taking off some of the excess skin. You're hiding the incision in such a way so that it's not going to become noticeable for most people.
Surgery does, come with some fear and some concerns. The fear was before, the fear is not now. The fear was walking into Dr. Jared Nimtz's office, for the first time into a plastic surgeon's office. That sounded so big, yet it felt very small once I got in, because the staff, from the time that I signed in to where I got to actually meet Dr. Nimtz, was just so warm and so supportive. And I think what made the connection for me with him was that he allowed me to interview him as well as him interview me on what was important to me.
When somebody is coming in interested in facial rejuvenation, they have a lot of questions. You don't always know what the backstory of somebody's experience is. And so I try to do my best to give them everything and make their face look as nice as possible.
I could think about this a whole lot and create, all kinds of fear. Yet this was an elective surgery. I fully asked and inquired and really did get to that place of comfort where I had to let the fear go. Once you do your homework, once you have the support of those that love you and care about you, the fear, it's time to let that go. I have a chance, I have a choice. This was not a emergency surgery where I wasn't able to prepare for it mentally or physically. And I have that choice and I have that time. So that's where I'm at right now, and there's no fear in that.
By and large, a lot of what we deal with is just regular everyday people who say, hey, look, I've had 3 kids and I want my body back because you know, I feel young. Inside I feel young. I want to look young. And I think that's a very normal thing for people to want. And so we try to do our best to restore that and to give them that sense of confidence or sense of self that they feel on the inside.
If this is something that you're thinking of and you have the right team around you, that there is really no judgment. I'm just like any other 50-something-year-old woman who has a full life, who has a wonderful family, and now I'm just at an opportunity and a place in my life where I'm able to kind of think about me. And I hope that the next time that you and I are sitting here, that you learn a new Kentucky word called dang, you look good.
After the commercial, let's finish watching Dr. Jared Nimtz perform the facelift. Like us on Facebook and join in on the conversation. Now that we have met Sharon, let's finish watching Dr. Jared Nimtz perform the facelift. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
A facelift has been done in different varieties for close to 100 years. When facelifts originated, back in the glory days of Hollywood, it was done as a skin-only facelift, basically. So that's one component of what we do today. As time has matured, or as the procedure has matured, we have switched things up a little bit. We have started to suspend the deeper portions of the face so that restores that volume in an upward direction to combat gravity. Some people do things more superficial, some people do things a little deeper, but in essence, basically what you're doing is you're trying to resuspend the face and to give it that more youthful appearance. The principles that you're trying to fight against are things such as the aging process of skin, gravity, loss of volume, or gain of volume in a place where you don't want it. Okay, so those things are not going to change. The exact ways that people do the facelift differ from surgeon to surgeon. The ways that we address it, yeah, we may use liposuction now, whereas a couple years ago they may not have done as much liposuction. We may use more fat grafting now than they did even 10 or 15 years ago. So those things do change with time, but those principles are pretty rock solid. On Sharon, we did do some of the laser resurfacing. What the laser does is it takes off basically the outer layer of skin and peels it off, gives you that healthier layer of skin underneath, and it may even out some of the uneven areas. Okay, we're just injecting her belly with some lidocaine to numb her up so that we can go ahead and harvest our fat. Doing something like facial fat grafting is going to work even better, and hopefully is going to be longer lasting than any kind of temporary dermal fillers. We are now up on the face, and we're prepared to do our fat grafting. I've made a series of very small holes through which we're going to put a small little cannula, which will then deposit the fat into the places that we want. All right? If you do the facelift with the facial fat grafting, often you're going to get a better overall result. In Sharon's case, we did a combination of those things, right? So we restored some of the volume within her cheeks and lips and so forth, and around the corners of the mouth. And we also took off some excess skin. When you're doing a facelift, you are creating a skin and fatty flap. You're taking off the outer layer of skin and fat from the underlying muscle and deeper structures of the face. And then you're basically pulling that back to create a tighter, more youthful appearance. At the same time, you're tightening up some of the deeper structures of the face as well to give it some more of that fullness that we were talking about, or lift up things that have sagged down with time. We did a combination of those things. We lifted up some of the cheeks that had fallen down. We did the facial fat grafting at the same time to restore some of that volume. And then we pulled that skin back. You cut off that excess skin, and some of that skin is in front of the ear, some of that is behind the ear. And between the two of those things, you can restore the mid-face, the lower face, and the neck, and create that contour that people are looking for. There's a short amount of recovery period, and there is some healing to do with incision lines, and that may take a couple of months for everything to mature and to go from a reddened phase to a more relaxed phase where it's only just a straight line, and that line is hidden within the ear. I thought it was a very successful operation. I thought that she's going to have a great result. Overall, people do very well, and within 6 months or so, they have the exact results that they're looking for.
When we get back, we'll check in with Dr. Jared Nimtz and Sharon to see her final transformation. Transformation time, everyone, here on The Younger You. Let's check out Sharon's before and after shots. Welcome to the show, Sharon. How are you?
I'm great. Thank you so much for having me.
Well, we have thoroughly enjoyed your story and truly appreciate the time that you have taken out of your life to have a traditional full facelift, everyone. How do you feel?
I feel wonderful, and basically because the things that I was dissatisfied with, I'm so satisfied with now.
Okay, what were the problem areas for Sharon?
Sharon had a couple excess wrinkles here and there. She had some older areas of scarring that we corrected. She also had some excess skin around the eyes and so forth.
I remember you were telling me in one of the interviews that this was the right time for you because you're an empty nester, your kids have grown up. Why now to have a facelift?
Timing is everything. The later you wait, the more involved and the less choices.
Is that something Dr. Jared Nimtz said? This is a really good question. If you wait too long, what's the deal there?
Well, it's always easier to make someone more youthful, look even more youthful than they were before. As we all age, there's an excess of wrinkling, there's a loss of further volume, and so the picture just becomes a little harder to correct.
Okay, what were your main concerns before having a facelift?
My main concerns were just that the aging was advancing faster than I felt like I was. Yeah. And I was noticing that in my eyes and in my neck area, and I just felt like it was time to kind of even things out.
I have to be honest with you, Dr. Jared, that she looks so smooth and ease. Do you know what I mean by that? She's not tight. She's not puffy.
Right. It's not overdone.
Yeah.
It is appropriate for her face.
I think this is another question. When you do a facelift, you're moving the muscle. Is that correct?
You're moving deeper layers of tissue. It's
Right.
not necessarily the muscle, but,
Okay.
it's suspension ligaments that help keep things together.
Got you. Sharon,
Yes.
what has everyone said?
Well, interesting enough, this has not been kind of a dinner conversation, but
It is now.
but it is now. So we'll see what everybody has to say. But those that knew me well and that I did share it with, they were just very complimentary. And the funny thing is that those that didn't know but that know me would say things like, "Did you change your hair?" Or, I like that new mascara. I mean, things that were related to the
But they-
facial changes, but they couldn't
And they couldn't
quite.
put their finger on what
Right.
was happening.
Right.
Okay, I want you to be honest with everyone.
Okay.
Now, we know there is a little bit of soreness. Dr. Jared already fessed
Okay.
up to that and said there is a little bit of pain in having a facelift. Talk to the viewer at home and tell them, what were you feeling after the process?
I think the recovery, of course, is a very important area to be familiar with on what's going to happen after the surgery. But I think the best place to start with the recovery of this type of surgery is to get a qualified surgeon
Yeah.
and to follow the post care. And that is so critical, both of those areas. And for me, in less than a week, I wasn't ready to go out to the mall, but I did go out upon his approval and plant a few flowers in my backyard. And,
Yeah.
and the pain was very minimal.
When we say post-care, that's super important. What were your instructions?
Basic things like I want her to keep her head of bed elevated to help decrease some of the swelling. I don't want her running around doing jumping jacks and that sort of thing, but I do want her up and moving. I want her going to the bathroom and going to the kitchen and just doing the basic things of life.
How do you feel about your results?
I love them.
Yeah.
I love them. I feel like I'm very satisfied with the areas that I was dissatisfied with,
Interesting.
and just brighter.
Anything different you would have done?
I
Can
don't
you see
think
any
so.
nips and tucks that you'd like to do
Well,
now?
I mean, there's always small things you can
Yeah.
do here and there, but you want to get an improvement. You want those comments that she talked about. That's the kind of thing that's the mark of, I think, a very good surgery.
We are going to be working on the quality of my skin, which I think is so important too, to follow up with a facelift. And some of that we were able to do in surgery, but due to time constraints, and Dr. Nimtz also wanted me to be healthy and healed before we went further, but
Gotcha.
that's just as important too, and they just have a great after skin
Would totally
care
recommend
procedure.
him, wouldn't we?
Yes.
Yeah.
Totally.
He's great. He's great.
Totally.
All right, we appreciate both of you. We appreciate you and the time that you've taken. So thank you. Thank you, of
so
course,
much.
Dr. Jared. Alrighty, everyone, if you are looking to tighten that lax skin in a natural way, avoiding the undesirable pulled back look, maybe this facelift is the right option for you. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week. Next week on The Younger You, Bluegrass Medical Aesthetics teaches us all about their weight loss program called HCG. Now, this is a medically supervised program, so we get to watch Rhonda and Dean give it a try. See you all next week.